In this video, we will discuss about the importance of OXPHOS process or OXPHOS activity on SETD2-deficient pancreatic tumors. In the previous video, we have understand that this mitochondrial OXPHOS is increases in the SETD2 mutated pancreatic cancer cells. So here they wanted to check whether this SETD2 deficient pancreatic tumors has any impact on the survival rate, or and if somehow this SETD2 deficient cells can be targeted, will this cause increase in the survival rate of the patients or not? This is what their objective of this figure or of the experiments that are presented here. First, they check using this antibody, that is Gboxin. Gboxin is used to target OXPHOS or inhibit this OXPHOS pathway, and they check the organoids that are developed using the KC cells and KSC cells, and they have find out is that the Gboxin works well in the organoid that are developed from the KSC cells compared to the KC cells, as the decrease in the size in the organoid from the KSC cells is high compared to the decrease in the size from KC. And these things are quantified on the right hand side of the panel A, where we can see that the decrease in the organoid size has a p-value of 0.048, whereas decrease in the organoid size in KSC has a p-value of less than 0.001. Indicates that in the previous video we have understand that this tumor cells that are differentiate or derived from KSC cells has more impact on these OXPHOS pathways. So inhibiting those OXPHOS pathways from the cells that are derived from KSC will cause more decrease in the size of the organoids compared to the organoids that are derived from KC, as the OXPHOS pathways are not that much upregulated in the organoids that are derived from KC. And thereafter they check the since increase in the OXPHOS is seems to be considered as tumor stemness, that is tumor cells that acquire the stem cell like characteristics. So they check the other factors of the stem cells in those organoids, and they have find out is that in the case of KSC these stemness factors are high, and when they are treated with the Gboxin, those stemness factor goes down significantly. And from the panel B we can see that its p-value is around 0.001 for this TMRM, and for the other stem cell factors such as KLF4 and KLF5 also goes down when the KSC derived tumor cells are treated with the Gboxin. Thereafter they did the in vivo study using the modified version of Gboxin, that is Sgboxin, which is used for in vivo injection, and they did the imaging or H&E staining after 12 days, and we can see that before treatment the pancreas spleen looks like this on this kidney, and after the treatment we can see that the increase in the malignant infected areas increases in the DMSO, whereas it decreases in the case of Sgboxin. And the treatment is done twice per week, that is mice are injected twice per week with this Sgboxin and DMSO for control. And after that they check the this lesion area, or we can say the malignant area. In the case of DMSO the malignant area is high, and in the case of Sgboxin malignant area is low. And these things are quantified in the right hand side, where we can see that lesion areas are low when the mice is treated with Gboxin. And when they check the frequency of liver metastasis in the same, they find out that the non-metastasis livers are found. Some of the cases where non-metastasis livers are found in the when Sgboxins are used for a treatment, whereas all the cases for the control, that is DMSO, they see that liver metastasis occurs. And in terms of survival rate also, the survival rate of the mice that are treated with Sgboxin is higher compared to the case of survival rate of mice that are treated with DMSO. And once they validated that this OXPHOS inhibitions leads to high survival rate, they checked whether this G-boxins use of gene boxin will cause decrease in the OXPHOS, which should reflect in the oxygen consumptions. And this is what they have expected, and the results are also as per the expectations using this oxygen consumption rate. And they can see that in the case of control, the oxygen consumption rate are high, whereas in the case of SG-boxin, oxygen consumption rate are low. And these things they have checked it for different factors such as ATP productions and basal maximum respirations. For all the three cases, they see the results are statistically significant. That is, it goes down when the SG-boxin is used. And then after validating that this treatment, this OXPHOS inhibitions can increase the survival rate and also reduce the oxygen consumption rate, they did the further analysis on the pancreatic tumor weight and its lesion area on this SETD2 wild type pancreatic cancer cells and SETD2 knockout pancreatic cancer cells on the mice. And in this case, what they have find out is that when the SETD2 wild type is used, SG-boxin has minimum impact on the pancreatic tumor cells, whereas SETD2 and SETD2 knockout cells or knockout pancreatic cancers is injected in the mice models, they see that the impact is significant. These things are quantified in the H&E staining also, where we can see that in the case of wild type, SETD2 wild type, the decrease in the tumor volume is less, whereas in the case of this SETD2 knockout, the decrease in the tumor volume is high. And from the H&E staining, it is not clear, but when we see the quantifications in terms of the lesion area, we can see that lesion areas decrease when the SETD2 wild type is used is around p-value of has around 0.046, whereas when the SETD2 knockdown is pancreatic tumors are used, and in that case the treatment of G-boxin leads to the decrease in the lesion areas, and its p-value is around less than 0.001, indicates that SETD2 knockdown has a more impact of SG-boxin compared to the SETD2 wild type pancreatic tumor cells. And in terms of the pancreas body weight, they see a negligible or minimum effect on the SETD2 wild type cells, whereas decrease in the pancreatic cancer of body weight is more in the case of SETD2 knockdown cells. That has a p-value of less than 0.001. And thereafter they check the survival rate in this SETD2 wild type and SETD2 knockdown cells using G-boxin treatment, and they have find out that in the case of SETD2 knockdown, there is increase in the survival rate when the SG-boxin is used. That can be seen here, whereas in the case of SETD2 wild type, the increase is not statistically significant, or increase is just minimal, marginal increase in the survival rate when the pancreatic tumor cells has SETD2 wild type and the SG-boxin is used for the treatment. And they check the oxygen consumption rate in all these cases, and they have find out is that in the case of SG-boxin in SETD2 SETD2 wild type and SETD2 knockdown goes down compared to their respective control cases, indicating that the SG-boxin is doing its function of inhibiting OXPHOS in the pancreatic tumor cells. After that, they check this OCR at different positions, that is at different locations, that is basal respiration, maximal respiration, ATP productions, similar to what they have did it in the panel H. And what they have find out is that in the case of SETD2, in the case of this SG-boxin treatment, the oxygen consumption rate goes down in all the three cases, and in both SETD2 wild type and SETD2 knockdown. So this all together indicates that this OXPHOS activity plays an important role in SETD2 deficient pancreatic tumor cells. However, it also has some impact to some extent to the SETD2 wild type pancreatic tumor cells also. If you want to understand more about these experiments in detail, you can go through the reference that is provided in the description. That's all for this video. Thank you for your time.